A lot of patients are afraid, and I say find your voice. A lot of patients are afraid to push back on doctors. And I don't mean push back in an ugly way, in a mean way. I'm just saying ask the questions that might be tougher. Listen to your gut.
Welcome to Give a Heck. I am your host, Dwight Heck, and for much of my life, lived my life in quiet desperation, wondering how I was going to pay the bills, take vacations, save for retirement, and one day wondering if I would get off the hamster wheel of life and have purpose. A life that most of society lives, which takes us to work, then home, then repeat, and pays us hopefully enough just to survive. The harsh truth that most live with more month than money and have no idea how to live life on purpose, not by accident. This ensures the mass majority are living not just financially broke, however emotionally and mentally as well due to financial pressures. In each episode, I will introduce you to thoughts, ideas, and guests that can help you to learn how you too can live life on purpose, not by accident.
Good day and welcome to Give a Heck. On today's show, I welcome Melissa Mallaby. Melissa is a clinical psychologist, healthcare expert, advocate, and clinically acclaimed author, has devoted her career to helping people navigate and understand America's very complicated and imperfect healthcare system. After the unfortunate death of her mother from ovarian cancer and an 8-month-long nightmare, I will add, Melissa began a passionate journey to fight for patient advocacy. During my mother's cancer diagnosis and treatment, I saw firsthand the failures of a broken medical system, a system full of good people working in a critically deficient framework, says Melissa. Her memoir, Not in Vain, A Promise Kept, is an unflinching chronicle of loss that takes a hard look at the state of medical care in the United States. Melissa is on a mission to help patients and medical professionals improve the quality of care in America by raising awareness, facilitating communication, and educating others so they don't have to go through what her family and mother did. I'd like to welcome you to the show, Melissa. Thanks so much for agreeing to come on and share with us some of your life journey.
Thank you for having me.
You're welcome. So, Melissa, and those that are new to the show, I start off my show with a discussion of a person's origin story, from their earliest recollections to where they are today, because it helps the people listening, it helps me be able to understand where you're coming from and why you're on the current journey that you're on today. So if you could do me a favor, share whatever you feel comfortable with, starting at whatever age, your origin story and where you are currently today.
Okay, I was born about an hour from New York City in a small town called Brewster. My parents were blue-collar workers. I had one sibling. I still have that sibling. I went to public school systems. From the beginning, I was pretty much a tomboy. I did things that were usually against the grain, especially back in the 70s. One thing I remember distinctly was in 4th grade. I went to music class and I told the teacher that I wanted to play drums. And he looked at me, and this is back in the 70s, and he said, "Girls don't play drums." And he handed me a flute, and I was terrible at the flute. I practiced for, I don't know, a couple months, and I could never get it right. And he heard me practicing one day, and he said, "Are you the girl that wanted to play the drums?" And I said, "Yes." And he said, "Go buy yourself a pair of sticks and a pad." And I did. And the funny thing about that is once I started playing and practicing and taking private lessons from middle school through high school, I was first chair in the band, which was kind of cool because when you're first chair, you get to give the other people their parts. So if I wanted to play the drum set, I could play the drum set. And if somebody, I could make the boys play the bass drum or the cymbals or the timpanis or whatever I felt like for the day. So that was kind of cool. I guess if I'm honest with myself, I didn't always follow the rules, I guess. I was the second child, so my sister always teases me and says that I got away with a lot more than she did. Um, my dad was a operating engineer for 40 plus years. My mom was a waitress from, the day I was born until the night before we took her to the emergency room. She was waiting tables. So again, blue collar family. My sister and I had chores we had to do all the time. We weren't afraid of work. We had expectations. We had rules. We had times we had to be home. They weren't strict, but we had to follow the rules. I think I probably spent, I don't know, a lot of my high school weekends grounded because again, I wasn't always on time or didn't always follow the rules. And yeah, we had a good life. We were learned the value of a dollar. We weren't spoiled by any means, but we knew that my parents were hardworking people, and yeah, that's sort of our story. That's my story. That's kind of the quick buy story. I did continue to play the drums. I played in some heavy metal bands, which is kind of funny. A lot of heavy metal bands in New York City. We gigged in New Jersey. We gigged in the boroughs. Locally. We It was an all girl band, which people didn't expect. I think we probably could have got signed, but that's a luck thing, and we just didn't get it. Um, I married my high school sweetheart, and he joined the Marine Corps. And after he joined the Marine Corps, I went and moved down south with him in outside Camp Lejeune on Topsail Island for a couple of years, which was very fun, especially in your early 20s. And when he deployed, I came back up to New York and went to graduate school.
So you've had the thing I like hearing is I find that people's origins when they grow up in a blue collar environment and they have rules, but they don't necessarily always follow them. They skirt them and get in trouble, but they have a
Hmm.
pretty normal life. I find when they become young adults into adulthood, though, they're more grounded.
Oh, for sure. Yeah.
People that I communicate with that have parents that are jet setting around, or they're always keeping up with the Joneses or the Smiths. They're always
Hmm.
living a facade. Then their kids try doing the same. They don't know how to have a grounded life because life isn't meant to necessarily be perfect. No child's perfect. As a single dad
Hmm.
of 5 kids, my kids weren't perfect. They snuck out. They did things.
Hmm.
They knew dad was out for the evening working with a client, and they broached the fact. And the only reason they ever got caught is sometimes I'd go to appointments before the age of, all this technology, and the person wouldn't be there. So I'd come home. Well,
That's how I
guess
got
what?
caught. Yep.
One of the kids weren't home, right? It's like,
Yep.
where's such and such? And then other kids would try, you know, fabricating stories or whatever. And that's how people got caught. And I look back at it and think to myself, that's life, right? Things are going
Well,
to
listen,
happen.
I'm glad I had a curfew because some of my friends that didn't have curfews are the ones that got in trouble. So at the time, did I want to have to be home by midnight? No. But my mom was a waitress, so she was up because she worked nights. And a lot of times she got home around 12, 1 o'clock in the morning. And if I was late, she was up and waiting. And, my mom, she would ground me and I would sometimes be able to get out of it. But when my dad grounded me, it stuck. So that meant it was pretty substantial what I did, or I never did bad stuff, but I did enough to get in trouble, and
Well,
I deserved it.
you're a teenager. You had angst and
Yeah.
things that you wanted to accomplish. And yeah, with my kids, um, you know, it was tough because when I got divorced, they were very young and had joint custody. and there was mixed messages. So
Mm-hmm.
you having that consistency, whether one was tougher on you in grounding
Mm-hmm.
than the other, at least there was consequence, right? There
Yep.
was some wiggle room with one, there wasn't with the other. That's the yin and
Mm-hmm.
yang of being raised. My
Mm-hmm.
kids would go to an environment when they weren't with me where they could, like you said, your friends, it was a free for all.
Yep.
They could do whatever, right? So
Yeah.
then when I got full-time custody of them, I had to reprogram them because they had a parent switch, right? They
Yeah.
acted a certain way with dad, a certain way with mom, and all of a sudden
Mm-hmm.
100% with dad, and dad's a lot more like your dad.
Oh yeah. Oh yeah.
More, this is the way it is. Sorry, you know what? This is life. You learn now, because in the future, when you get into trouble, it won't be me that you're answering to. It'll be the police or some person
Yeah.
of authority, and it could ruin your life. So let's figure this out. This is a consequence, right? And it is what it is.
Mm-hmm.
We have to have defined things to live within. Wouldn't you agree? It's
Oh, for
important for us,
sure. Yeah.
even in society itself. People say, "I wish there was no rules."
No,
We need to
it
have
has to be
rules.
rules. Yeah. I mean,
Anarchy.
yeah, I mean, I used to work in downtown Manhattan. My doctors are in the city. My husband works in the city. Um, I stay out of it as much as possible right now. That's not a place where you want to be hanging out. And it's just from what you said, because there's no accountability for people's actions, and it's not safe. It's just not safe.
And
So, I mean,
it's kind of scary though, isn't it, Melissa? You think about even 100 years ago, right? In the 1920s,
mm-hmm,
people were still walking the streets carrying guns. There
mm-hmm,
was outlaw justice still. There was
mm-hmm,
sheriffs and legal stuff within our North American society, and people didn't feel safe. They were
mm-hmm,
protected by the rancher who had hired guns or whatever. And now all of a sudden you move into a more cultured, civilized society where you think you're safe. And then it seems that in some ways we're de-evolving back to, this is the wild, wild west. We're going to do things how we want to do it. And if be damned if you don't want to listen because we have a gun. Right. And I'm
yeah,
not talking about gun ownership, whether or not
mm-hmm.
people have the right to own a gun or not own a gun. It's just that I see a lot of de-evolution even in my country of people taking things into their own hands. More so after the pandemic. I don't know if you feel the same way or
I
not.
think so. Yeah, it's like to me, it's like a boiling pot of spaghetti that's just boiled over. Especially in New York City. Um, you know, my personal feeling is because there's no accountability, because we have a revolving system of not keeping people accountable. Um, you know that's why you have people that are continuing to commit crimes, because there's no standards. They're not being held accountable, and it's everyone. It's not one particular person. It's everyone, and it affects everyone. And you know it's unfortunate, and that's exactly what is happening. People are on subways, and they see somebody getting beat up, and instead of helping, they're videotaping it. I mean, I don't know. I mean, me from a personal experience as a female, if I see somebody getting kicked in the face, I'm not going to videotape it. I'm going to try and help them, unless I'm, trying not to get shot. But that's what people do now, is they'll do whatever, as they say, for the gram, versus, trying to help. And the cops' hands are tied, and there's good cops, there's bad cops, but at the end of the day, um, it's just the way life is right now. And that's why I'm
Live in terror every time you get on public transit, right? We have that
yeah,
problem here in our train system. We have it on our bus system. There's, people have been in bus shelters and gotten stabbed, and there wasn't even
yeah,
any correlation to knowing that person. Just
mm-hmm,
absolute violence and just stuff like that is where they've literally, our province, which is for those listening in the States that aren't realizing, a province is the same as your state, right?
mm-hmm,
Our provinces are a lot bigger than most states. So, and we literally last year they had to implement our premier, which would be your guys' governor,
Mm-hmm.
literally mandated and brought in extra police force in the two largest cities, which are Edmonton and Calgary, because of the amount of violence that had been
Mm-hmm.
happening within the trains and the bus system. And it's not always necessarily people that are homeless or people
Mm-hmm.
that are or mentally ill. There's
Mm-hmm.
just some bad people out there, right?
Yeah,
That
no,
kicks out
I drove
of terrorizing people.
the other day. I was down the city and I had to get off the Deegan, and I decided to travel through the side streets to get back up to, my part of the woods. And, it's to a point where you gotta hope that you get through a light. You don't want to get stuck at a light in certain areas because there's so many people that are, you can tell that they're clearly on drugs, they're clearly mentally unstable, they're knocking on your windows, they're coming to your cars, they're standing in front of your car, they're 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 drugged out of their mind. And unfortunately, in my opinion, and I've worked with MICA populations, mentally ill chemical abusers, um, we're at crisis levels. And you know instead of helping these people, or trying to find them treatment centers or get them off the street, um, we're putting up places where they can get clean crack pipes and clean rigs and clean needles and enabling. And
We're doing the same garbage in our city, and those
yeah.
listening that don't appreciate our opinion, everybody, even you listener or people watching, you have the right to your opinion. I don't necessarily agree with it either. I have it's polar opinions from different people within my associations and in my tribe, and literally they're doing one in our city right now. It's been the people have been fighting, and people saying, well, they got to go somewhere, and within 4 blocks of this usage site, there's
Hmm.
4 daycares, there's a
Yeah.
school, and residential is less than a quarter block away from it, like
Hmm.
an older area of the city. And they're putting use area there, and the police say, oh, we'll monitor it better and blah blah blah. And the
Yeah, they
businesses
don't.
around there and freaked out. The city did some underhanded stuff and approved it without doing a consensus of the area. So now it's going. I haven't talked to my friends that are in the area that have businesses, whether or not it's escalated to court yet, but it's the city's getting taken to task over it.
Hmm.
And everybody's saying, oh, you don't care about these people. Well, sure, but we can't care about that part of the community and discount the fact that there's multiple daycares, there's a school, there's
Hmm.
residential with young people living all around there. And
Hmm.
yes, some of those people that are drug addicts that are using and stuff, it would be safer to give them a usage area, but it also puts it into a perspective of, you know, where are you solving it? You
Right.
know,
Yeah,
at
and they.
least if you're going to give them something, hopefully you're weaning them off and you're helping
Yeah.
them, and you're giving them addiction counseling, giving them counseling centers. You're not, it's a band-aid. All you're doing is trying to centralize where they are as opposed to them being everywhere. But where do you put that safely where the general population is safe?
Yeah, no, that's absolutely the fact. And if you've looked at pictures of like South Philly, LA, most of the big cities, Chicago, it's everywhere. And you know, we can give out so many Narcans, right? Make them available. But sometimes I know people that have had patients that, they've gotten 2 shots of Narcan and not come back because now they have the
But
the
even those
case.
Narcon kits, they're not the easiest to use, depending on which ones your
Yeah,
community, your society buys.
right.
Like the Narcon kit that I have, because I knew, it's people have been saved, right? All of a sudden, I
Hmm.
seen somebody on the road, I'd get out, but
Hmm.
it's not like an EpiPen injector. I
Yeah.
wish it was, right? Meanwhile, that person could die because I'm nervous and fuddling around trying to fill
Hmm.
out. Like it's just
Well,
if
it's so bad that.
do smart solutions
Yeah.
that our society needs to do.
Yeah, and it's so bad now because of this veterinary tranquilizer they're putting in called Trank now that Narcan doesn't work with. So now the city in New York is trying to give kits for you to test your drugs to see if there's this Trank in it, so the kids don't take it. It's like, what are we doing? It's to me, you know, as somebody that's worked with people with addictions, had family with people with addictions. I mean, listen, I get it, but it's to me, it's just enabling. It's just like you said, it's like, you know, using a hose on a brush fire, and it's just spreading, and you know, it's just not good. And there's been cases, there were cases last year where um it was some little like pre-K school in the Bronx that a little kid picked up a pill that was in the, you know, in the right around where the play area, and it was fentanyl, and they survived, but that's what it was. And he, you know, what do kids do when you're 5? You put everything in your mouth, and they just happened to pick up something that looked like an M&M, put it in their mouth, and it was fentanyl. You know, it's just, I don't know. It's very scary. I mean, even my son is 13 years old, and, you know, trick or treating, you know, you don't eat anything until I look at it. And that's just
Even then,
unfortunately
there's no
reality.
guarantee. Even then, there's
Right.
no guarantee. I know
Exactly.
parents now that don't take their kids trick or treating. They
Yep.
take them to they there. We have communities that have safe Halloween. They have them
Yep.
in a big hall, or we have some of our malls around here that'll do safe Halloween. And just because of the fact of the level
Yep.
of, danger, not to
Yep.
mention the fact, let's feed our kids a bunch of sugar in a
Hmm.
diabetic world. you know uh,
Yeah.
like, anyway, we could get into lots of different conversations.
Sure.
We're gonna get going on with some other things that I wanted to discuss with you, but this has been a great conversation thus far. So, first off, sorry about the loss of your mom. Reading up on you yesterday and going, very emotional, very, heartfelt, the what you've, shared out there, that
Hmm.
I could, obviously go and read and look into. So one of the things that I wanted to discuss with you, though, is after the unfortunate death of your mother from ovarian cancer, you started a journey to fight for patient advocacy. Most
Hmm.
people have no clue what that is. I do, because I
Hmm.
believe in that. And I've had other people, again, 20 some years of helping people with their family stuff. Many people need patient advocacy. So, can you
Hmm.
do me a favor, Melissa? What is patient advocacy, and how would it have helped your mother had the opportunity been there for her and you were able to utilize it?
You know, when my mom got sick, I mean, I'll start back. You know, my mom was, again, for 40 years, she was waiting tables. Very strong, half Italian, half Irish woman. Never missed a day's work, even if she didn't feel good. And you know, my dad had some heart problems, and we always, you know, just kind of thought in the back of your heads, never wanted to say it out loud. It'd always be my dad first. Never thought in a million years my mom would ever be diagnosed with cancer at 68 years old. Um, you know, unfortunately that happened. And, you know, my mom is from the generation that they call the silent generation, where, you know, they're sort of doctor adverse. She didn't only went to doctors if she absolutely had to. And that's kind of something we learned the hard way. She wound up calling me one Saturday afternoon, crying. Telling me that she had uh, a mass, not a mass, but a bump in her stomach. And, you know, honestly, I don't know how I didn't see it because I saw her all the time, but she hid it. She wore extra large shirts. And me playing doctor, we took her to the emergency room, and um, you know, I thought, no big deal. It's probably just like an intestinal blockage. They'll do surgery, easy, no big deal. When she was in the emergency room, she kept saying to me and my sister, you know, I know this is bad. I know this is bad. I watched it on Dr. Oz. You know, I think my mom sort of was self treating for a couple months before she actually told my sister and I that this thing was growing in her abdomen, because again, she was working. Um, so in the emergency room, they did a CAT scan, and the doctor came back, and he had, you know, his nonverbal communication said it all. And he asked if he could talk to my parents by themselves. And, you know, he didn't say he was for sure that it was cancer, but he said that it was a 23 centimeter mass on her ovary, given she was postmenopausal and her symptoms, you know, she needed to see her general practitioner or an oncologist right away. And that started our journey, you know, with this diagnosis. You know, it took us. couple weeks to get her in to see an oncologist. And this was back in 2010. So roll the tape forward to 2023. We're probably looking at 4 to 5 months here in the US. But it, me and my sister just kind of tag teamed and kept calling the oncologist to get her in, get her in, get her in. And, she finally got in, and I'm jumping around. I didn't really answer a question on patient advocacy, but
That's
I'll get
okay.
there.
No, I prefer this. That's great.
Okay, so she went in, and um, she saw a doctor who my sister and I at the time were not very fond of, because she was a straight shooter, and she was a female from Iranian descent. She was very smart, but again, from the minute we saw her, she said, "If your mother has this, I don't know if she does, but I think she does, and it's not a friendly cancer." And you know, she was kind of, my sister and I used to call her, gloom and doom, because she, sort of, we felt that she was very negative. But in the end, every hypothesis, everything that she warned us about, everything she thought could happen, absolutely did happen. And looking hindsight, I appreciated that more of some of the other physicians that we dealt with
She
that
was very
were,
direct.
yep, and some of the other physicians were not completely transparent, made a lot of mistakes, and gave us false hope. So you don't want to hear it when you're in it, the gloom and doom part. But every single thing this woman said came true, unfortunately. But she was, as you'll read in the book, she was a great person, and I'm still in touch with her to this day. Um, as far as patient advocacy, where do I start? Um, from the beginning, when my mom got her biopsy, I found out later, when you have ovarian cancer, you have a mass. Surrounding that mass is something called ascites. Ascites is common with cancer. It's fluid buildup around the tumor. Um, we found out, I found out years later, that they only tested the ascites, which is the fluid. They didn't actually get the needle into the tumor itself. Had they got the needle into the tumor itself, they would have found out that it was 4 different kinds of sarcomas, versus the normal platinum treated ovarian cancer. So from the start of my mom's journey, the chemotherapy protocol that we agreed to put her on, was ineffective, and we found that out the hard way. I'll roll the tape forward. Once she got the diagnosis of cancer, she was they wanted to do surgery right away, and we wanted to do surgery right away. We wanted to get it out as soon as possible. Unfortunately, her platelet levels were too high pre-op. So when you have platelet levels that are really high, it makes you a big stroke risk. So they decided to try 3 rounds of chemotherapy to shrink the mass, and then that would make for an easier operation long term. So, you have no choice but to agree to that. So she got the first round of chemotherapy, and she felt okay, was kind of a layup. So we were like, okay, we can do this. Second round started to get some bad symptoms, which are common with chemotherapy. Third round was, before the third round, let me backtrack. Second round, she started getting what we call wasting disease. Wasting disease for a cancer patient is, you never see a heavy cancer patient, an overweight cancer patient, because cancer eats the good cells as well as the bad cells. And she started to lose a lot of weight, lose her appetite, and quite frankly, waste, as well as she was very depressed. And so we said to the oncologist, before we agree to a third round of chemotherapy, we want to do a CAT scan and see if this approach is being effective, because it seems like it's just making a sick lady sicker. So they said, okay, called in the CAT scan. My mom got the CAT scan. Before the third round of chemo, my sister brought my mom to the oncologist. The oncologist said, great news. The tumor shrunk in half. So me and my sister were like, holy mackerel, we're doing the jig. This is fantastic. So we got my mother the third round of chemotherapy. The week after that, she met with this doctor who was the surgeon, that we called the Grim Reaper. And she told my sister that she read my mom's films with the radiologist, and the cancer had not changed at all. The tumor had not changed at all. In fact, it grew. So at that point, we had just poisoned my mom a third time to a treatment that was having absolutely no effect except slowly killing her, and as she was suffering. So they read the CAT scan wrong. So there's throughout the book, every month from the diagnosis, which was May 1st, well, pseudo diagnosis, till the day she passed away, December 4th, I note what happened in that month, the roles my family took, the role I took, because each of us had different roles. My mom's, what I perceived as how my mom was doing with trying to deal with her own, possible mortality. My dad, all the family dynamics. But each month there was a whoops, there was a mistake, there was a film read wrong, there was miscommunication, there was some really gross errors, like
A lot of negligence happening.
yeah, I mean, here's one. When you have cancer, it's very common for you to get blood clots. My sister noticed my mom's breathing was a little weird, so I happened to see the oncologist in the hallway, and I said, listen, can you just come look at my mom? She was in a outpatient radiology appointment, and she wasn't planning to stay, but I said, can you just take a look at her, because her breathing's a little weird. And I happened to see him at the elevator, and he came, and he's like, I don't think anything's wrong, but we'll admit her just to make sure, et cetera, et cetera. So that night, my mom was up in the cardiology unit, and I was there after work, and one of the residents came in to ask what her healthcare proxy was. And my mom she was on Ativan, she had taken Ambien, she was on pain meds, and she said to him, if there's no hope, I just don't want anything. And with that, he took his pen and paper and left her room. And I said, Ma, I said, you just told him that if you have a cardiac arrest tonight, you don't want anything. She goes, no, I didn't. I said, yes, you did. And I knew what she meant. But I needed to get him back into the room, and I sat him down and I said, sir, what did you just hear? And he said to me, your mom wants nothing. She's no code. She doesn't want anything. I said, absolutely not. I said, she doesn't want a vent, and she doesn't want a feeding tube. God forbid things go south. If she has a cardiac arrest tonight, you absolutely have to save her. And with that, he updated his record. Then it gets worse. I happened to look down at her arm because I'm leaving, I'm looking at her IVs and stuff, and we're talking. And I look at her bracelet, and it has another woman's name on it. Now, your bracelet is your medical record. It's your meds. It's your allergies. It's your diagnosis. It's everything. And I know exactly the woman's name that's on it. I'm not going to say it for her privacy, but I had my BlackBerry at the time. I was tired. It was 9:30 at night. I didn't think to take a picture of it, but I did get the head nurse, and boy, did they cut that off very quickly. And that was a big deal. I mean, my mom, I said, you were on a cardiac floor. You could have gone down at 2 a.m. for an angiogram and not even known it, because at that point you were somebody else. And you hear those stories happening in the news where somebody gets the wrong knee done for surgery, but this was real.
No,
So
it's real. It's real. Well,
yeah,
improper surgeries happen all the time. Malpractice insurance is getting tested at a high in North America on a constant basis, and it's not always because of that the doctors and surgeons aren't good. They're overworked. They're having their own challenges in their lives that they're dealing with, and trying not to bring that to the job. Forget it. Our home life affects our work life, and vice versa. It is the reality of life. And we have a government system in North America that just keeps on sugarcoating and brushing everything over.
Right. Yeah, no, it was a big deal, and they cut it off. But throughout every single chapter in my book, I was in communication with the patient advocate. I went to see the patient advocate personally. Every month I was in touch with the patient advocate. She was a lovely person. She always said the right things, but the problem is she has no ability to make change. She's just a messenger. So a lot of times you'd get a letter that say, thank you very much for bringing this to our attention. We're going to discuss it with the leadership panel. Um, we're sorry that your mom went through this, blah, 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 which, okay, thank you. But that, that doesn't really,
So
that doesn't change.
it's a pacifying letter without real any substance to it or teeth.
Yeah, and I'll tell you in a little while how I just went through this again with my dad, but you know, as far as advocacy, this is the deal. A lot of patients are afraid, and I say find your voice. A lot of patients are afraid to push back on doctors, and I don't mean push back in an ugly way, in a mean way. I'm just saying ask the questions that might be tougher. Listen to your gut. Um, you know, be your own advocate, especially if you're on a lot of medications. Um, be an active participant in your own health, meaning, I have a lot of millions of GI issues. I know exactly what doctors I've seen. I know what tests I've had. I know what meds I've been on. I know what surgeries I've had. That's very important because you need to be able to say that to any specialist that you see. Um,
Well,
right
all that
now,
documentation is important too, because when you're dealing with healthcare insurance too,
yeah.
had people on my podcast and explained the nightmares and wrote a book about it, and now have a giant group that all they do is deal with the miscommunication and the handling of claims and the lies and deception from the health industry, from the
Oh yeah, that I
insurers.
mean that's I mean you know my mom ultimately got surgery, and the night before, again, this doctor pulled me aside out of a room, and she's like, Missy, your mom's very sick. She goes, I have a feeling this might be a palliative surgery, meaning I'm afraid we might open her and close her. That happens if they feel like there's nothing they could do. So just be aware that that could happen. I didn't want to hear that, and it scared the hell out of me, and I kept it to myself. But the next day, my mom was in surgery for 9 hours. So they, quote unquote, optimally debulked her, which means they got everything out of her except for microscopic. So we were thrilled. I mean, we thought that what couldn't happen, it actually did happen, and they were successful. And I mean, we were in the patient lounge. All of us were crying. My dad was crying. The doctors were crying because this was a really complicated case, and it was a really difficult journey. And she survived it. She did a couple weeks in inpatient rehab, which they had their own rehab facility. And again, here we go with issues, and we could talk for a day about issues, but at one particular point, she called me up and she's like, they started me on this new medication and I'm really dizzy. And I'm like, well, what is it, Ma? And she read it to me, and it was a drug for hypertension. My mom was hypotensive, meaning she had low blood pressure. Her normal blood pressure was 100 over 70. And this physiatrist decided to call her in hypertensive meds. Why? If you give somebody that has low blood um, pressure to lower your blood pressure, they're going to pass out. So I left work. Thank God I had a great employer. My executive vice president knew what I was going through. He said, you need to leave. Anytime you want to leave, you leave. We'll sweep up after you. And I did. And I can't thank them enough. Um, I went over there. I said to the physiatrist, why did you put my mom on hypertensive meds? And he basically gave me the whole white coat doctor thing. I'm the doctor. I know what I'm doing. I'm making the choices, deal with it. Pretty much like that. So with that, I got my car and I drove to the cardiologist's office, who she did have a cardiologist at the time. And I walked in and they're like, you don't have an appointment. I'm like, that's okay. I'll wait. I need to speak to Dr. X because this doctor put my mom on a medication. She's currently in the hospital, and it has to be discontinued, and he's not going to do it. So I'll wait here. And so she came out and she sat in the waiting room like, who the hell is this girl? And I'm like, this is what happened, this is what they did, and she discontinued it right away. And, you know, these are the kind of things that happen every single day, all day long. And, you know, before I left to go in my car to go to that cardiologist office, I said to that physiatrist, I said, if my mother falls because she passes out and breaks a hip or something worse, you are 100% accountable. And, you know, that was kind of the theme throughout her whole illness, you know,
Constant, constant missteps,
constant
constant
battles.
misdirection, constant deception, constant vibrato that I'm, look at me, I'm the doctor, I'm this and that. And I'm not picking
Yep.
on doctors because I know a lot of great doctors. In
Yep.
any profession, you can have people that are full of themselves, that are,
Yep.
or they used to be a great doctor, but because they've been beaten down so much by a system that doesn't support them properly, they're mind numb, they're emotionally
Well,
numb, and they lose their sense of compassion and empathy and kindness. It's just, I see it all the time too. I have story after story of that I've dealt with in my lifetime of improper medical attention. Even when my 4-year-old granddaughter passed away a few years ago, I'm still convinced there was malpractice. But you know what I mean? They hide things so well. It's so hard to find the truth. And I was in the hospital constantly seeing her.
yeah,
Right?
no,
It was just,
that's the thing. Like I tell people, like if you have a loved one and you have the ability, loved one, friend, neighbor, and you can be there, you really have to physically be there. Another one of the probably most gross errors that they made was they did after she had the surgery, they had to do cleanup chemo. That was for the microscopic that was left. And it was 4 days inpatient. I was at work. My sister texted me. My sister and I are we're polar opposites in a lot of ways. And the subject line of the text was effing terrible. My sister does not curse. So with that, I Googled the chemotherapy that my mother was being put on, and I printed it, went to the hospital, took one look at my mother. She had every symptom of toxicity, poisoning, except coma and death. And this was only after one bag. And I called the oncologist. I knew he had a boat. It was Labor Day weekend. And I said, I said, listen, I need you to come look at my mom. Um, uh, something's wrong. She doesn't look good. And he came. He took one look at her. He said, she's fine. You need to stay off the internet. Sorry. Do you want to pause this a minute?
now.
So one of the most egregious mistakes that they made was, she had cleanup chemo that was going to be done post-op. And my sister texted me, I was at work, and she alluded to the fact that it was very bad. So I Googled the medication that my mom was on and ran over to the hospital. I took one look at her. My mom had every symptom of toxicity, which is poisoning, except coma and death. And I called the oncologist and I said, please come over and see her before you leave. It was a 4-day weekend. He had a boat. It was Labor Day. So I knew he'd be unreachable. And he came, he took one look at her, and he's like, she's fine. For Connie, we have to go for cure. This is normal. This is all normal stuff. And by the way, Melissa, you need to stay off the internet. And you know, okay. So, he's a doctor. Unfortunately, me and my sister were like, okay, he's got to be right. She just survived the surgery, so he must be right. Next day was a Saturday. I'm always very good to every single nurse because to me, they're the connective tissue to how well you're going to do in any hospital. They are probably one of the most important people that you see. And, 98% of them are great at what they do and want to be doing what they're doing. And we had a nurse that had seen my mother before, and she called me on my cell phone. She's like, Missy, you need to get here. I have orders to hang another bag of chemotherapy. Um, this isn't the Connie that I know. Basically she's putting her neck on the line, and she's not going to hang a bag because she sees what I saw the day before. And was waiting for me to get over there. So I rushed over there. And again, same thing. We called. Now we're seeing the oncologist team member, not the guy that has seen my mom for all of these months. And he came, and this is a whole nother story. But when you see a doctor for a long time, or for some kind of severe disease, and one of his partners happens to see you once out of the whole journey, he doesn't know you. He or she doesn't know you. They don't know what you look like when you're okay. They don't look like when you're happy, sad, depressed, your normal, the normal way you speak to people. And again, he looked at her and again said she was fine. And my dad at this point came over, and my family and I were clinging on to hope, and we figured, well, these guys must be right. I mean, they're the specialists, they do this for a living. So they hung the second bag of chemotherapy. And at that point, the next day I went and I found my mother flat with her arm hanging off the bed, and she was throwing up, and there was no nurses around, and she could have easily aspirated, which a lot of patients that are on chemotherapy can die and have died from aspiration pneumonia, because they choke on their own vomit. And at that point, my head exploded, and I basically said, I cannot trust you, and didn't leave the hospital. We stayed there until Monday. And Monday, the same doctor that told me to stay off the internet came into my mom's room. And at that point, there was a priest there, because that's how bad my mom looked. And my dad was there, her brother was there. And I was leaning up against the bathroom, and I remember he turned around and looked at me, and he's like, you're right, she was toxic. And I'm like, listen, I'm in the reinsurance industry. I said, and I used a couple expletives, but I'm like, this is your job. I said, I Googled this, and now she's toxic, and when you're toxic from chemotherapy, it's not like, it's not like something where you could take charcoal or some kind of treatment and you're okay. Like, my mom lost 3 weeks of her life, like, going in and out of consciousness. She was having delusions. She was hallucinating. She could not move her head without throwing up. And I think at that point, he had kind of lost hope. It stole her spirit. It stole her drive, being poisoned that way. And the surgeon and her team came into the room, and they knew it, and they knew that we were upset and frustrated. And she asked if they could actually write a white paper on, this type of med. It's called ifosfamide toxicity, and it's rare, but it can happen. And this was the absolute example of why I tell people, even though it's not easy and it's not comfortable, that you have to find your voice. Because I wish that I, at that point, had stuck to my gut, had pushed harder to get, I don't care, 5 other doctors to come look at her, not just, one guy that met her for 10 minutes. I don't know that would have changed her outcome, because I found out years later that the type of cancer that she had was very rare. There were 4 different sarcomas, and it's basically a death sentence when you have them. But I do wish that I had not. I wish that I had not allowed them to tell us that, oh yeah, it's okay, she's fine, because she wasn't fine, and I knew that, and we just listened, because that's kind of what you do.
Well,
That's kind of your role.
her last weeks, months of her life would have been a lot different. And I hear this from a lot of people in regards to chemotherapy or going into radiation, and how, well, I've experienced it with clients, with family. It's absolutely horrible, the degradation of their life, just so that they can possibly live. Like, I'm not saying that we shouldn't take the chance if we have educated
Yeah.
people helping us make the right decisions. So patient advocacy is very profound, in the sense that people don't realize that they do have a voice. They have more of a voice
Yeah.
than they realize, and they can stick up for those they love. And, you know, you're going to get backlash. I know my daughter, before my granddaughter passed away, she for 2 years didn't leave the hospital. My daughter
Mm-hmm.
stayed with, literally did not leave the hospital except to
Mm-hmm.
go outside with her in a wheelchair to, you know, to help her out, get some fresh air. And, you know, there was nurses, you'd hear them grumbling, or they'd pull me aside because they knew I was coming every day. You know, you need to talk to your daughter. It wasn't necessarily
Mm-hmm.
nurses. They were relaying what the doctors were, how the
Mm-hmm.
doctors were treating situations and circumstances. And they were, like you said, the glue, right?
Mm-hmm.
They're the backbone. One of my daughters, by the way, is a nurse. She's a travel nurse and travels around
Mm-hmm.
the country, going to smaller places that need help. And, you know, the horror stories she's told me as well, and the lack of respect, telling
Mm-hmm.
you even that comment about stay off the internet, and then
Mm-hmm.
later telling you, oh, you were right. Well,
Mm-hmm.
that
Right.
changes nothing. Your words are empty. How about you do your job properly, like you're talking
Well,
about?
that's it.
So,
That's it. Yeah.
you know,
It's like, you know, and I mean, you know, for a long time, it took me 10 years to write the book. And, you know, to be honest with you, the first, oh God, I would say the first couple years after my mom passed, I was a horrible griever, I guess, if you want to say. You know, I have a master's in clinical psychology. I know all of the stages, all the steps, and what the DSM-5 says that you are to be acutely depressed, PTSD, general anxiety disorder. I had it all, and I was too smart to get help, and I needed help. But I kind of felt like I'm the type of person that, because my job was so good during the 9-month battle my mom fought. I mean, you don't find employers like that. I felt like I owed them because I was out so much, in and out, in and out, and they actually offered me, after she passed away, short-term disability just to get my head together. And I was too proud to take it. I figured, oh, let me work. It'll take my mind off it. I felt like I kind of owed them, and it wound up backfiring significantly. I sabotaged myself. I was down to 115 pounds. People saw it at work. I mean, I was wearing size 0. I would layer my clothes, and it wasn't because I was purging or anything like that, but I just wasn't hungry because I was completely mental head case. And you know, I I I was taking benzodiazepines so I could even have conversations with people without crying. I was taking antidepressants, all of which you know, I was familiar with because I worked in mental facilities. I worked in psychiatric emergency rooms. I knew what they did to you. I knew the effect they had on you. I knew the dangers, especially of meds like Xanax. And thankfully, I discontinued them on my own. Um, but for probably a good year, maybe more, I was my own worst enemy, and I had a toddler, so it was a lot. But you know, I managed. But where I'm going with this is, I started writing the book um, shortly after she passed, but it was full of rage. I mean, I'm talking to you now because a lot of time has gone by, and I can keep it together because time has gone by, and I've healed, and I sought help. But the first couple versions, if you read the book, it's just full of rage, and I had to put it down and then pick it back up when I was at a better place. And I had a bunch of people that I either professional editors or even just people that had lost parents through cancer, or you know, writers, publishers, whatever. Just look at it as far as what their thoughts were on it, as far as editing. And it's funny. One of the consultants that I had edit my book, she lost her mom to cancer, and she read it, and she loved it. And you know, of course, she gave me feedback. And if you read my book, I do drop a couple F-bombs. I'm from New York. I'm pretty direct myself. And, I had to make a decision of whether I was going to be me or, sort of sugarcoat me. And I decided to be me. And if you read some of my reviews, cool thing is, and I'm not trying to be egotistical, but people say that they feel like they're talking to me at their kitchen table because I allow myself to be vulnerable and transparent and real. And I do talk about uh my I start the book with a letter to my mother, and it basically tells her what happened to me after she died, how I grieved, how I messed up, how I sabotaged, how I could have easily become addicted to benzodiazepines, how made bad choices, how I finally did seek mental health care and wound up sticking with the woman for 6 years. Um, and I did that for a reason, because I wanted to tell the readers that even with fancy degrees, you can fall down. Even with fancy degrees, you don't know everything. And I did not know everything. And it cost me mentally and physically. So I wanted to share all that. And, also I added, again, after years of, I guess, calming down about the situation, every chapter I end with what I learned and what I would do differently, based on, from getting diagnosed to, every month of different things that happened to when she passed away, hospice, what I learned from that, and all those things around that. And then all of a sudden we go into a pandemic, and I had this crazy thing happen in October of 2020, which you can't even make it up. I have a bunch of GI problems. I've had them forever. I had a bad stomach ache, but I have a high pain tolerance. But I wound up having my husband bring me to the emergency room. I was there 7 hours. They weren't that busy. Basically, it was so bad that I could not reach my phone, because if I could, I would have dialed 911. Uh, they did a endoscopy. They scoped me about midnight, and they found nothing. They were discharging me, and I couldn't move. I was on morphine. I couldn't move, but they were discharging me. My discharge papers were written out. And at one point, I said to one of the nurses, I said, this is effing ridiculous. And I became a code gray. I became a code gray because I cursed, but I was dying. And when I got up to go to the bathroom, thankfully, I passed out from somewhere between my bed and the bathroom. And I woke up, and that same nurse that had just unplugged all my vitals, all the vitals and stuff that they're looking for. The same nurse that told me I was a code gray, she also told me I wasn't going to get anywhere with that kind of mouth, was flooding my body with fluids, because my blood pressure was 70/30, and my beats per minute were about at 147, and I was failing. And what wound up happening was, long story short, they called a hospitalist down. The entire time I was in the emergency room, they never took a CBC, which is just a blood count. Had they taken a blood count, they would have seen that my red blood cell count was 2. I had an internal bleed. If they had done that, they would have seen that, but they never did that. But damn, did they do that COVID test real quick. And they never did a CAT scan either. They need to, people that present with abdominal pain, that's usually the first 2 things they do. They do some kind of picture, and they do some kind of blood work. They did neither. They did a scope, and I don't know how the doctor did not find this, but what I wound up having was something called gastric volvulus. Gastric volvulus is rare. I'm young to have it, but basically my stomach flipped and disconnected from my spleen, and my stomach was full of blood. And that's why I was 70/30. My red blood cell count was 2. I couldn't stop throwing up. But in the discharge papers, it says patient has no abdominal pain. Patient's fine. Patient's going home. Follow up with your general practitioner. I woke up 2 days later in intensive care. Thankfully, a hospitalist came down to the ER. He had to change the entire record. I was admitted. I got a CAT scan the next morning. This was the time where you could not have any family or friends in the hospital with you because of COVID, which I got, but it was very, very scary. And all I remember is it was something out of Grey's Anatomy, being run down the hallway. Nurses are putting the cap on my hair, putting IVs in my arm as I'm running down the hallway. And I woke up the next day in intensive care. And all I remember is asking the doctor is, did someone call my husband? Because you can't have anybody there. And basically, if they had discharged me, the surgeon and other doctors that I have told me I would have died at home. I wouldn't have woke up the next morning. And so thankfully I passed out, and this was in that same hospital.
But
And
there's malpractice all over the place
oh
throughout your
yeah,
story, though. Like, it's everything you're talking about would make me want to leave. I
yeah,
wouldn't live there anymore. I'm just
yeah,
being
no,
honest with you,
no,
because
that's what
that is so
yeah,
broken.
yeah, I it gets worse, and I'll tell you why in a minute. I wrote the CEO of this hospital. I wrote the person in charge of the emergency room. You get all the flowery wording, letters back. Oh, we're sorry. We're gonna, do this to, we're gonna make this our teachable moment. We're gonna learn from your case. Yada yada yada. I did call a medical malpractice lawyer in my case. The fact that I didn't die, they're not really interested in it. And my thing is, it's not even about the money. It's just more of the utter,
Shining
um,
light on the ignorance and, well, it's not
and
even
just,
ignorance, the stupidity, because they should know better. That's
and,
their
and,
job.
but it's just gross negligence, because how do you have
Yeah.
a surgeon scope you? When they scope you, I've had them done 20 times in my life. They put the scope, which has a camera on the end of it, into your stomach. How do they not see that your belly's full of blood, and also done a 360 and is turned the opposite way and your spleen is removed? How does that even happen? You know?
Yeah. Well, it's just
Eh,
like with your mom too, them not seeing and finding things either, right? So
yeah,
yeah, I'd leave the state. I'd
yeah,
go
yeah.
somewhere
No,
else.
this isn't a different state. It isn't a different state. And the good news is that I have very good insurance. So a lot of the stuff I do go into the city for, especially important stuff. But, recently, at the end of December, my dad passed, and
I'm sorry to
we,
hear about that.
yeah, and I appreciate that. My dad, he would have been 82 this April. He was diagnosed congestive heart failure 17 years ago. And, you know, for that kind of diagnosis, 17 years is a good life. He had a pacemaker defibrillator that was put into him that was never used, thankfully. Um, he never asked anybody for help. He was putting batteries in his truck in November. He was picking up all the leaves on his lawn in November. Like, he was always doing stuff that me and my sister were like, Dad, let's help you. Let's, don't get up on the roof in 100 degrees and tar the roof. But that was just my dad. That's his generation. They didn't ask anybody for anything. He became sick the middle of December, and he was end stage congestive heart failure. It really sucked, but the pump had been going wrong in his heart for a long time. But now it was the electric, but we didn't know that at the time. And it's a long story, but he was an inpatient twice in the month of December. The worst part about it is a couple things, and this is where now my patient advocacy and my um, podcast interactions, media, everything I'm doing all day long, because it's not only not acceptable, it's disgusting. On Christmas Day, he his defibrillator went off a couple times, and me and my sister were there, and we called the ambulance. The ambulance came, and he went into VTAC right with the ambulance there. They gave him stuff in the ambulance, brought him to the hospital. They stabilized him at the hospital with the stuff for the pace of his heart. And he was, once they got his pace squared away, he's ready to get out of there. That was just the nature of my dad. And he knew that he wasn't well, but he wasn't really willing to give up. And we talked to very smart people from Colombia, and they asked us if we wanted to consider putting in a heart pump. And my dad didn't want to go down that road. He was 81 years old. It was a very big surgery. The rehab would be very difficult. He wasn't a city guy. So he said, no, just give me medicine. I just want to go home. And they said, you might need palliative care, home in the house, that kind of thing. And we were in agreement with all of that. And, we started engaging those resources, the day after Christmas. And so we start on the 26th of December, engaging those resources, social workers, doctors, hospice representatives. And we sit down with palliative care people on the 27th, and he just wants to go home. He wants to live the rest of his days at home with us. And unfortunately, they didn't have the staff. That's what we were told. They didn't have the staff. They didn't have the resources, and they couldn't make it happen. So we just kept showing up and following up. And, it got to the point where the people that were in charge of making these things happen were 2 doors down from his room. I was very nice. I would knock on the door, excuse me, do you have a update? No, we don't have anything at this time. So it got to the point where I was starting to get aggravated, really aggravated. And I told my sister, I said, you know what? I'm going to go sit at the elevator and watch. She's going to be leaving at 4:30 because it's the end of the business day and we're still not going to have an answer. And sure as hell, who do I see? The person in charge of getting my dad the hospice stuff in order was leaving without giving us any answers. So at that point, they said they were going to give us a private room. And he was starting to fail rather quickly. And I told my sister, I said, we're not going home. And she's like, yeah, we're definitely going home. I said, Alicia, we're not going home. I said, this isn't happening. I could feel it. We're not going home. And, with that, we got a private room, and he started to actively die. And I had asked the doctors to put pain meds, benzodiazepines, comfort meds in his regular regimen 4 days before he died, and not where he has to ask for them, because I knew he was not in the condition to ask for him, nor was that the way he was. And they didn't do it. So the day before he passed away, I slept over. My sister and I both slept over. And again, the doctors failed to put in the orders for comfort meds. So here I go again. And when my mom died, I mean, she was so weak from cancer. While I had terrible images for years of watching that, watching my dad was 1,000 times worse, because I don't know if it was because he was a man. I don't know if it was because it was sudden. I don't know if it was because he was fighting it. But it was horrifying, absolutely horrifying. And at one point the night before he passed away, my sister and I asked one of the nurses, please call the on-call doctor and get us something, please. And they called, and they got a pill called in. My dad didn't have the ability to swallow anymore. He had the death rattle from the day before, and they called in a pill. I'm like, what freaking planet are you guys on? And make a long story short, the entire night was horrifying. And the head nurse came in about 8 o'clock the morning of the 30th, and she looked at me and she said, I wish you and your sister had made this decision a day ago. And I said, and that's where I was tired. I hadn't slept. I was crying. I said, we made it on Tuesday officially. We started the process on Monday. This was Friday morning at 8 o'clock. I said, are you out of your beep, beep, beep mind? And with that, a palliative care nurse practitioner came in. She took one look at me, took one look at my dad, and she said, okay, we're going to call in the medication. And I said, how long? And she said, 5 minutes. I said, no, really, how long? And she's like, 5 minutes. And it took about an hour and 15, which after what I had already witnessed for 72 hours, an hour wasn't going to change much. And they eventually did, get him the comfort meds. The doctors, two of the doctors that I liked and that were consistent, um, apologized to my sister and I in the patient lounge, but at that point it was too late. We had already
Yeah, but
watched.
their apologies are empty, just like they were with your mom,
Yeah, that's it.
even
They're
with,
like,
or with you.
yeah, yeah.
It is disgusting, like you said earlier.
It's not acceptable. It's not okay. And right now I'm in the process of discussing with the people that are in charge at this facility, because um, this is not the first person this has happened to. This is not the last person this has happened to, and it's going to continue to happen. And they need to have some accountability. And I'm not afraid to tell my story. I'm not afraid to write letters. I'm not afraid to sit uh, on the other side of a table from a CEO, because they're a person just like me. But I am not going to have my dad be their aha moment, their learning
Oh,
experience,
yeah,
their,
those crap letters that's saying that this is going to be their teaching moment. But
yeah.
what can somebody immediately start doing that's, to make a difference and take up raising the awareness mantle themselves with all this stuff that's going on? People that are listening to this, what can they immediately do, Melissa?
This is what I tell a lot of people is there's a couple things. You have the terrible stories, like I just told you, three of them, right? But is if you're actively sick, if you're actively ill, if you have a loved one that's actively going through something, first thing I always tell people to do is have your patient record, have your patient file. If you don't have it hard copy, get it electronically. You need to have it. You need to read it. I looked up. I combed my dad's for a month. There was about a 50% error rate in his file. They wrote, the emergency room doctor said that he was not. He did not take his meds as he was supposed to. It was complete crap. He absolutely did. In fact, the meds that they said that he did not take and that he was not compliant on, he wasn't even on before this admission. They copy and paste. The other thing is, again, know your disease process, know what you have, know what doctors you've seen, know what medications you're on, know what they're for. A lot of times people don't know this, and I've done enough podcasts with even doctors that I know what they look for when you go. You have that 10-minute window when you're speaking to them. They want to know, what's your history, um, what medications have you had, what tests have you had, what surgeries have you had. If you have a symptom, when does it happen? What makes it worse? What makes it better? Like, if you spend your time in a doctor's office and you're having to think of those things, you're not going to have the time to give the doctor the full picture. So if you can go prepared with stuff like that, um, you're going to get better value out of your visit, better value out of your appointment. Um, you know, the other thing I always tell people is, that you're in charge of your your healthcare, you're in charge of your insurance, you're in charge of the doctors that you choose. Um, recently I had to find another doctor for uh, reasons that you can imagine. And you know, on the internet, you can find out what people think of doctors. I mean, I'm very pro healthcare
W-
provider. I'm very
We
pro
have a
nurses.
medical system here where you can go and it rates the MD, and it actually has a scoring system, and people can leave comments.
Yeah, that's
The medical industry hates it, but that, oh well,
yeah, that
you can
that's
pretty
that's what I tell people. It's like,
yeah,
if you're gonna,
research the doctor you're seeing, like, honestly. If
yeah, if
and don't be afraid to say, hey, I want another opinion. Oh, I want another opinion. And
mhm,
if they're smug with you, their diagnosis is smug, right? If their
absolutely.
attitude and their personality is smug, the way they run their diagnosis and their advice is smug, and run the other way.
Yeah, and they should want that second head opinion. Yeah, that's the way I look at it. They should want that. Yeah,
And
you're right.
don't have a second opinion from a doctor that's in the same practice.
Absolutely.
Yeah, that's
Yep.
I hear people say, oh, we had somebody else, and oh, well, I'll call in my colleague. No, you're not going to call in your colleague. I'm going to get somebody that's not even in your office, that doesn't even know you, may know of you, but there's no ties, so that there's an
Yeah.
unbiased opinion
Yep.
based
And
on their
don't think,
experiences.
yeah, and don't think that they're not all connected, because most of them are. I mean, for
Oh,
me,
absolutely. And depending on the community you're in, absolutely.
oh yeah,
Right.
yeah. And you have to be your own advocate. Like if you're gonna buy a car, you're gonna, and you do that research to see which car you want based on feedback, or how the engine works or whatever. Why wouldn't you do that for what doctor you're gonna pick? Like for me, I had an example where I had Crohn's and I needed to get my colon out. The doctors close to where I live, probably 60-70% of them said I was going to come out of surgery with a bag. I didn't want a bag. My nephew had a bag. I just was hoping I would not have to get one. I got another opinion in the city. And the doctor said to me, I'm 95% confident that you're not going to wake up with a bag. And I didn't. So just for me getting that second opinion and trusting this woman, instead of having to have three surgeries to fix if you get a bag, I only had one, and I was in and out in 5 days.
It's
So
difference of a person being compassionate, because my brother-in-law had the same surgery for colitis, and they
mhm,
every year he'd get scoped and they found cancer.
mhm,
So he was told by most people, because we have the committee of they, people
mhm,
listening, I'm doing air quotes, the committee of they thinks they, you know, you take other people's, well, this person had this surgery, they're having a bag, it's you're going to have that happen. And so my
yep,
brother-in-law thought for sure, and he had a couple doctors that come in, and one of the doctors said, you know what, I'm pretty sure I can do it. It's going to be a little bit longer, but I'm pretty sure I can do it. You're not going to have a bag when you woke up. And
mhm,
even though he gave him hope, but it was the confidence of that doctor and the
mhm,
body language, tonality, like my sister said. We just knew that he was genuine,
mhm,
that he was real.
yep,
Brother-in-law had the surgery, he's got no bag. And that
yep.
surgery was over like 10, 15 years ago,
Yeah,
right?
that's what this woman said to me. She looked at me it was a Friday. I was really sick. And she's like, okay, we need to do this. And she's like, when can you, and she asked me, she goes, when do you want to do it? And I said, okay, well, when can you do it? Because of course I was a little scared. She goes, how about next Tuesday? And I'm like, okay. And it was just that easy. And, again, if I had not done my due diligence, I know in fact, I'm 80% confident that I would have had the three surgery deal where, they give you the bag, then they have to, do two other surgeries to correct that. So, I always, the internet could be, when my mom was sick, it was not always your best friend, because you saw a lot of the bad
The
prognosis of
horror.
ovarian
Yeah,
cancer. Yeah. But at the
absolutely.
same time, it did give us information that was not readily available. Like, for example, when she was toxic, same thing with my dad.
So
Now that I'm,
take it with a grain of salt. Anything you search on the internet, though, you should always look at different. I tell people, don't click the first things. I don't care what you're researching, what service you're using. Click on it and read other stuff. And then we're so emotional because of what we're reading about medical stuff. Get somebody that's not directly tied to it to read the same thing. Maybe it's a
mhm,
close friend. They're tied to your emotion, but they're
mhm,
thinking of it differently. They approach and visualize and internalize things differently and read the same thing you're reading and say, so, John, Sally, what do you think of what this is saying? And then
mhm.
have a discussion about it. Don't too many people like self-diagnose over the internet, and they've never read more than one thing.
Yeah, absolutely.
It
That's
cannot
absolutely
be
true.
that it cannot do that. The de facto standard of people reading an article about anything, I don't care what it is, or listening to a media outlet about what's going on in the world.
Hmm.
That's one opinion based on their colored lens, right? You need to continually, people listening or watching, you need to be an advocate for yourself or for others. When you're researching, research more than one thing, talk to other people, see what their thought process is, develop a tribe of people that you trust that'll give you an honest, straight up opinion and not blow sunshine up your ass.
Hmm. Yeah, and that's sort of, I think, where we are now with like post-pandemic medicine. I know you guys have your issues. We have a lot of issues. You know, there's a lot of nurses that are here, and that have lost their jobs in America, that, have built, I want to say, like, coalitions, and are challenging the standards, challenging the norms, sharing
Well,
things that
the nurses take all
we.
the bullshit. They take all the crap. Like
Yeah, yeah.
I tell people in a normal hospital hierarchy, the doctor is the king, and he's
Hmm.
dictating to his servants, the nurses, the LPNs, the nurses' aides. They do all the shit, sloppy work, have to put up with all the garbage, the
Yep.
mistreatment. But the doctor gets all the accolades for 10 minutes.
Yeah, yeah.
5 minutes or
And
whatever. And the whole
yeah.
hierarchy of the medical system in North America, and really in a lot of places of the world, is broken.
Oh
It
yeah.
is
No.
completely broken. And we need to stand up and start telling people this. And why you're on my show, and I talk to people about it all the time, right?
Yep.
And
The other thing is
I read people's body language all the time when it comes to medical professionals, and you can tell when they're full of garbage too. Your
yeah, well,
radar,
that.
your spidey sense goes off if
Oh
you're
yeah.
actually listening for it.
Yep, and that compassion element, I mean, listen, when I was in the hospital in October 2020, all the nurses were, most of them had PTSD. They were overworked, underpaid. I'd asked a couple, hey, has the hospital ever bought you lunch? Any combat pay, because in with the pandemic, and they basically told me the only people that gave them anything were like local restaurants. Nothing came from the hospital. And I make sure I thanked every one of them when I'm, whether I'm an inpatient or whether I'm visiting somebody. I always try and help out the best I can, because they're completely understaffed. I saw that, especially the end of December with my dad, where a nurse might have 10 patients, which patient to staff ratios is, that's very dangerous, and I saw it firsthand. Um, you know, um, but the
Well,
compassion thing too.
the burnout is huge with nurses. So then you get the
Yeah.
older nurses that get to a point where they're mentally and emotionally numb, just like it happens with many medical professionals. And then they end up being put in charge of the other nurses. Or, my daughter will talk about units where there's 5, 6 nurses on, and the charge nurse isn't doing her job, is sitting there or
Hmm.
isn't even present. And there's 2 nurses that are compassionate, kind, and caring, doing all the work, while the other 3 sit there and visit, and
Yeah.
they're, you know what I mean, and are doing shoddy work. It doesn't mean they were always like that, but the system is killing them
Yep.
and
That's
making them
absolutely it.
emotionally dead, right?
And the other
It's
thing is
sad.
that
It's just
for
terrible.
us, there's so many, because they're short in staff. They have a lot of traveling nurses, or per diem nurses. And here's the thing that I saw. Like, in the first inpatient stay, he was in just a regular, I guess, just an inpatient sick unit, right? The next time he was in a cardiology unit. But in seeing the different nurses, most, I would say at least 50% of them did not pull a paycheck from the hospital. They were like temps or per diem nurses. So, if you're working in cardiology on Monday, you're working in med surge on Tuesday, you're working in, I don't know, dialysis on Wednesday, every single one of those specialties has idiosyncrasies and stuff you need to know to do your job effectively. And some of these nurses, and it's not their fault, they're just doing the more with less, because they're just overworked and they don't
Well,
have the staff, they don't have the
it's all
time.
band-aids. It's all temporary. It's not
Yeah.
healing the situation. It's covering it. I hear this all the time consistently. Or, like everybody in the US brags about Canada's healthcare system. We have our challenges here. Our national healthcare system, and what the media wants to tell you there, is that it's perfect. Yes, it's
Yeah.
perfect. I live here. It's got its own challenges,
Hmm.
and it's falling apart across our country, so much so that if you travel from province to province, they're recommending that you have travel insurance, even though
Yeah.
there's supposed to be
Jeez.
national health care to cover you.
Mm.
There's certain circumstances of horror stories where something's required and it's not getting dealt with, and you could be, even though they're not supposed to do it, you could be handed a bill by that province when it's supposed to be covered under the National Health Care Act. So, you know what I mean?
Oh
I've
yeah.
watched the evolution of our healthcare. One of the times it was the shining thing in the world was our healthcare in Canada. but
Mm-hmm.
it's not that way anymore. Now it's just used as, here's a bouquet of flowers, right?
Mm-hmm.
And we got it wrapped in some paper, but if you take the paper off, it's all rotten at the bottom. Like, you know what I mean? We're only seeing the top good, beautiful roses, but the rest hasn't been taken care and maintained. It's a facade, right?
Yeah.
So to hear the stories of what I hear, and you're not the only person that I've talked to. I've had people on my show that have dealt with so many different circumstances of it. I see that coming here and evolving way quicker than I'd like it to. And, you
Mm-hmm.
know, patient advocacy, being observant and making sure that we ask good questions and don't be afraid to stand up for yourself. I tell people that all the time. Well, the doctor's going to, you know, they're going to take it out on the patient, or once I
Mm-hmm.
leave, or they won't listen, you know, we're going to get blackballed. Well, better to be blackballed for sticking up for something you believe in. And, you know, like in our city, I don't know, let's 5, 6 hospitals, because we're 1.5 million people. We're obviously not as big as where you come from, but you know what? There's other choices. There's other places. Leave this city, go to a neighboring city. They got 5, 6 hospitals. You know what I mean? Like, there's never say never. That
Yeah, no,
don't
absolutely.
comply and don't lay on the side of the road and give up and die based on the fact of somebody's so-called profession because they went through and got a degree in medicine and they've practiced this long. It doesn't mean crap. Are they a good person? Are they kind? Are they
Yeah,
good? Are they a patient advocate themselves? They need
right,
to have
right,
that training in school and they don't get it.
right. Well, that's the whole compassion thing. Like I've seen my general practitioner for years, and he's retiring. He's I don't know, his 60s maybe, but he and I've talked to other doctors that, right now a lot of these practitioners are seeing patients every 10 minutes. You can't do your job in every 10 minutes. That's just impossible.
They
General
give them
practitioners,
15 minutes here. The
yeah,
GPs
primary,
here got 15 minutes. That's it.
yeah, and
No more than 2 things to discuss with
yep.
that person.
And that's more reason why you have to be prepared, because that's the only snapshot that you have. And
I make a
that
list
that's
if I
what's
go in.
scary. Yeah, that's the scary thing.
Right.
It's just, and primary care, a lot of medical students now, I just wrote a white paper on it the other day. They're not going into primary care because there's more overhead and they're paid the least. But the terrible part about that is here, with a lot of insurance policies, you need your GP to write a referral for you to see that specialist. So they're usually patient's first appointment. So, not only are they that important, but I think the statistics now are about 40% of their job is administrative because of these referrals that they have to write. So, that's another thing. I mean, I could go on
Yeah.
forever.
Well, we could keep on going for hours. We're already well over the time that I promised you we wouldn't be doing this, but I appreciate you giving some extra time and sharing your knowledge and your experiences. The last thing I'm going to ask you, and then we're going to wrap this up, is if you had to give our listeners one last closing message, Melissa, what would you tell them in regards to giving a heck and never giving up?
Hmm. I've been told from a lot of people, friends, family, close people that probably shouldn't tell me these things. Miss, you're not going to get anywhere. You're not going to change anything. Nothing's going to change in the hospital. Healthcare is what it is. Almost like, you're not gonna make a difference. I can tell you, and it's not an egotistical thing, I am making a difference. I talk to people globally. I talk to people like yourself. I spread my message. I'm working on an application now that's going to be giving tips when you go to a doctor's appointment. But, as far as giving a heck is, I would just say stick to your goals. It's not always easy at the time. It's not easy to be the person that is maybe going against the grain and not just being okay with people's um, mistakes, or holding people accountable. It's not easy to be maybe perceived as the difficult person, or the person that is not just going to, like you said, lay down and take it. But um, you know, my goal and my journey is to help others and keep speaking to people so they can find their voice, and so they don't wind up like my mom did or my dad did or me almost did. And that, there are things that you can do to help your healthcare outcome in many circumstances, and just keep at it, and you'll get there. It's not an easy road, but you got to keep at it.
Yeah, well, anything worth its value in life that you're trying to achieve is outside of our comfort zone. I don't care what it
Right.
is, right?
Hmm.
So, people listening or watching, do what you need to do and understand there might be some discomfort, but guess what? The person that you're dealing with as an advocate, guess what they're going through?
Yeah.
Far times worse than what you're going through. And if it has to do with yourself and you have to be your own advocate,
Hmm.
just realize that it could be giving you that extra opportunity to survive, to live, to
Yeah.
prosper again. So don't be afraid to challenge the medical industry. Again, for those listening or watching, there are a lot of great people in the medical industry, right?
Hmm.
I know a lot. I have clients that are nurses, I have clients that are in the medical industry. There are some really good people, but there's a lot of shitty people in all professions. So if you run into somebody that's garbage and doesn't want to listen to you, go find somebody else. I know that isn't necessarily easy. There's cities in our country where, like, my daughter lives in one of the cities in a neighboring province. They've been there for over 2 years and still don't have a doctor. They're on a waiting
Mm.
list. There's
Yeah.
such a shortage of medical professionals, right? So
Yep.
they go into a walk-in clinic where they see somebody. There's no consistency. There's no compassion. In and out,
Hmm.
right? Here, take a pill. No
Yep.
questions, no whatever. So that's another thing I'll end up saying too. If your doctor is always prescribing you stuff and not really present in the conversation, not asking you questions, and always writing you scripts, go run, because you
Yep.
don't know what that script is really going to do, because it's easy for them.
Hmm.
And
Absolutely.
push you out the door. They're going to get their clinic or wherever they're at's going to get paid, and next.
Yeah, that's it. That's exactly it. I mean, it's all of that. And we just have to give the people you know, the, not to be afraid to again find their voice. I mean, it's just in this stage of the game, you absolutely have to do it. And you're not always going to agree with everybody. Everybody's not always going to agree with your approach. I always approach every situation calm, cool, and collective, and I did in my dad's case until I could no longer be. And it's funny because, you know, me and my sister again were very different in that aspect. And she has her things that she's very strong in. I have my things that I'm very strong with, and that's why I think we work well together as a team. But you just have to do it. You don't have the option anymore.
Yeah, exactly. So our time is up. I want to respect our listeners and your time. However, before we end, can you please tell the listeners what's the best way to reach you?
My website is www.melissamallamphy.com. I'm on Instagram. I'm on Facebook. I'm on LinkedIn, and it's just my name. And I blog a lot on different emerging issues that are going on. A lot of it's healthcare,
Well,
some
you
of
have
it's
it on your
mental health.
website. Yeah, on your website, you have an actual blog area.
Yep.
Yeah.
Yes, I
So I'll
do.
make sure all that, I'll make sure, well, I checked it all out, of
Mhm.
course. I will make sure that goes into the show notes. For the new listeners, go to giveaheck.com. That's giveaheck.com, and go and hit the podcast portal button. You'll see Melissa's face, and below that, you'll see the abbreviated show notes. And I'll make sure that her links for all her social media as well as her website is present there, so that you can reach out and give a heck, and
Mhm.
realize that you can learn to live a purposeful life for others and live a purposeful life for yourself, and that you don't have to just sit back and let life control you. You can be the conductor in your own life, right? So
For sure.
thank any last closing comments?
Do your best to stay healthy. research stuff, and try and stay out of the hospitals.
Yeah, that's good advice. So thanks so much for being on Give a Heck, Melissa. I appreciate your time and sharing some of your experiences so that others too can learn it is never too late to give a heck.
Thank you for taking time out of your day and listening to Give a Heck. If you find value, I'd appreciate you sharing with your friends and family so they too can learn how to live life on purpose, not by accident. So you do not miss the next episode, please subscribe on your favorite podcast platform and please also post a review. I look forward to reading your comments. This has been Dwight Heck. If you want to check out other podcast episodes or today's show notes, please check out my website, giveaheck.com. And until next time, together let us all strive to give a heck.